Hi, I'm Dr. Vishal Vikas Nair, and today we'll be seeing a case of endoscopic coblation adenoidectomy. So, this is an unedited video, and I'll be demonstrating the left side adenoidectomy done using a coblator. So, I've used an infant feeding tube to retract the soft palate. My wand comes from the oral cavity, and we are viewing it from the nasal cavity. So, I'm using the coblator at a setting of 7 and 5, 7 for ablation and 5 for coagulation. So I start using the cobblator trying to get the superior limit, that is the periosteum below the sphenoid. And layer by layer, I ablate the adenoids. An important point, as you can see, there is some tissue which has gotten stuck at the tip of the wand. Don't start using the wand on the tissues at this stage. First ablate. Let the tissue get ablated and get absorbed, and then start using the wand. So I'm defining the superior limit. Another important tip here is whenever you feel that your scope gets fogged, you just go and dip it in saline and it clears up magically. Wherever you get any superficial bleeders, you use the coagulation function. And now I'm trying to clear and get a hold of the inferior limit, which is the Pesavint's ridge. So I'm clearing the tissues from inferior to superior and I am going towards the lateral limit. So as mentioned in one of my previous videos, the lateral limit anteriorly is the torus tuberous, which as you can see I'm defining now. And as we go posteriorly, it is the fossa of Rosenmuller. Again, you can see that there is some tissue which has gotten stuck at the tip of the wand. I don't start using it till I have cleared it. So I ablate, ablate, ablate and let the tissue get absorbed. And only then do I start using the wand. So as you can see, the cobbler is a beautiful instrument, layer by layer, under vision. It's a clean surgery. We as surgeons are so confident of removing the entire adenoid right up till the limits because we get a clean field and there is no bleeding. And also we are working at a very low temperature and there is very little thermal injury and hence less pain. So now we have gotten a view of the Passavant's ridge as you can see there, and that is my inferior limit, and I start ablating the tissues above it and I'm going towards the lateral limit as well. So again, an important point, as you go lateral you encounter bleeders, so be ready, be a little careful and cautious as you approach the lateral limit. And as we clear up the bulk and go, we reach the posterior limit, which is the buccopharyngeal fascia. Again, you can see how beautifully I'm clearing of the tissue from the fossa of Rosenmuller, which is the lateral limit posteriorly. Again, an important point, whenever you feel that your scope is fogged, just dip it in some saline which is present right there, and it gives us a very nice and clear view. The purpose of putting this unedited video is to show that we didn't encounter any bleeding. I didn't fog my scope much or had to come out of the nose. In the entire video, you would see that I have never left the nasal cavity. Whenever I found some amount of fogging, I just dipped it in saline, which is right there in the nasopharynx. So, to get such nice views, you should have a stable hand. Again, you will encounter some amount of bleeding. You can use the coagulation function of the coagulator to control the bleed. So I have finished, and you can see the amount of tissue that I've cleared in the nasopharynx. So if you have any doubts regarding the technique or in general, please do ask them in the comments. I'll gladly reply. Thank you for watching.